Hi everyone, welcome to session 4, which is tobacco use cessation. Like I said in a previous session, that we would actually not be using our workbooks for this session. We will actually be doing a Q&A with Jacqueline Dam, who is the tobacco prevention specialist at the Richland County Health Department. Hi Jackie.
Hi Ashley, thanks for having me.
You bet. So first question I have is, why is smoking bad for you?
Smoking damages nearly every organ in the body and is the leading preventable cause of early disease and death in the United States.
So since this is for the blood pressure management workshop, can you please mention how tobacco use increases the risk for stroke, disease of the heart, and cancer?
Sure. When you inhale cigarette smoke, carbon monoxide and nicotine enter your bloodstream. The carbon monoxide reduces the amount of oxygen in your blood, and the nicotine makes your heart beat faster and raises your blood pressure. This increases your risk of stroke. Nicotine is a dangerous and highly addictive chemical. It can cause an increase in blood pressure, heart rate, flow of blood to the heart, and narrowing of the arteries. Nicotine may also contribute to the hardening of the arterial walls, which in turn may lead to a heart attack. Tobacco is the leading cause of cancer, and remember, vaping is a tobacco product and just as harmful for your health, if not more so.
Wow. So why is secondhand smoke bad for you?
Non-smokers who are exposed to secondhand smoke are inhaling many of the same cancer-causing substances and poisons as smokers. Secondhand smoke causes more than 7,300 lung cancer deaths among U.S. non-smokers each year.
So how can you ask someone around you to not smoke, since we know it is bad for you, secondhand smoke is?
The Montana Clean Air Act prohibits smoking in enclosed public areas and says every Montana has a right to breathe clean air. It can be more difficult if it's a family member that you live with, but remind them of the dangers of secondhand smoke.
So what good can come from quitting tobacco?
There's a lot. There are a lot of great things. Within a half hour of your last cigarette, your heart rate and blood pressure typically drop to normal levels. Your risk of heart attack goes down just after 1 day without cigarettes and continues to drop after that. Within 48 hours, your sense of smell and taste start to return. Within 2 to 12 weeks, your blood circulation improves. There are people who actually lose their limbs, like their feet or something, from poor circulation from smoking, which I don't think many people know.
Mm-hmm.
Within a year, your risk of both heart disease and heart attack dropped to about half that of a smoker. Nothing else you can do has such a dramatic effect on your heart health. Within 2 to 5 years, your risk of cancer will be half that of a non-smoker, and in 5 years, your risk of stroke will also be the same.
Wow, so a lot of good can come from quitting tobacco, but how do you start? How do you quit smoking?
Some people can quit by setting a quit date, and they just quit cold turkey, which is amazing. Mm-hmm. Others benefit from a smoking cessation, such as the Montana Quit Line. They offer free nicotine replacement therapy, counseling, either online, text, by phone, or calling 1-800-QUIT-NOW, which is actually 1-800-784-8669.
And how can you stay smoke-free after you quit?
Remember your reasons for quitting and think of all the benefits to your health, your finances, and your family.
Wow, that's awesome. So last thing, if anybody has any questions or concerns regarding tobacco prevention, tobacco cessation, can they reach out to you?
Absolutely. I work here at the Richland County Health Department, and our number is 406-433-2207, or you can just Google the Montana Quit Line or call the 800 number that's on your screen now.
Perfect. So that wraps up session 4. Like Jackie said, any questions, concerns regarding tobacco use cessation, tobacco prevention, please feel free to reach out to her. And then if not, I will see all of you in session 5, which is physical activity. All right. Thank you. Thank you, Jackie.
Thanks, Ashley.